The first principle is patient is accepted exactly as he or she is, or accept the patient exactly as he or she is. The both way it is right only. Acceptance is expressed in the following ways. Number one, being non judgmental and non punitive. Number two, interested in the patient. Number three, accepting the feelings which patient may express. Number four, talk to the patient with a purpose. And number five is listening. The nurse should be a good listener to the patient. Now, let's see about the first method of acceptance, that is being non judgmental. So, non judgmental means you are not going to judge whether the patient is right or wrong, or we are not going to judge whether the patient is good or bad. And non punitive means we are not going to punish the patient if the patient is showing an unacceptable behavior, either directly or indirectly. We should not punish by different methods of behavioral therapy techniques like chaining or restraining, or like indirect punishments like ignoring or avoiding the patient. The second method of acceptance is showing interest in the patient. We should maintain eye to eye contact with the patient and know the interesting topics of the patient and make sure that the patient is happy with the conversation. The nurse should be honest. The nurse should know the likes and dislikes of the patient, and we should avoid the topics which the patient doesn't like. The third method of acceptance is we should recognize and reflect the feelings of the patient. So, if the patient is comfortable to express a negative feelings, it is a good sign. And the patient started trusting you, and the patient is going to express the feelings to you. The next method is talking to the patient with a purpose. As we discussed earlier, we should know the interest, likes and dislikes of the patient, and the conversation should be continued. And mainly, the focus must revolve around the patient needs. And the last method of acceptance is listening. So, listening is an important skill the nurse should develop. It's an active process. Nurse should take time and energy to listen to what the patient is saying. And the nurse should be sympathetic and should be genuine, and the patient should know that the nurse is showing a genuine interest towards what the patient is conveying. The second principle is use self-understanding as a therapeutic tool. Self-understanding means when a nurse is able to understand her own feelings, attitude, and expressions. Self-understanding leads a nurse to understand others' behavior and to be aware of why he or she behaves as he does. So here, the nurse is using the self-understanding as a tool for treatment of the patient's behavior. The third principle is consistency is used to contribute to patient security. It means the consistency should be maintained among all the staffs. One staff behaving or showing one attitude, and the other staff nurse is showing a different attitude and behavior which will distort the emotional security of the patient. The next principle is reassurance should be given in an acceptable manner. The psychiatric patients need constant reassurance as they are insecure and uncertain. They have to be helped to develop trust and confidence. How can we give a reassurance? By paying attention to the matters that are important to the patient. Be aware and accept how the patient really feels. Sit next to the patient even when he doesn't want to talk. Accepting patient silence and the physical presence can be very reassuring to the patient. And listen to the personal problems without showing any surprise or disapproval from your side. Here, a nurse must avoid few type of reassurance like you will get well, nothing to worry, all will end well. The next principle is patient's behavior is changed through emotional experience and not by rational interpretation. Emotional experience means, I think we all know that the people keep advising something. For example, so many people will advise, we'll tell that unless you experience it personally, you'll not be able to understand what pain I am experiencing. Same like that, when you're going to the psychiatric patient as a nurse, don't try to advise or keep educating them with what is right or what is wrong. The patient should experience it. The behavior should be changed through the emotional experience and not by rational interpretation. Giving a rationale for the negative behavior, it will not change the patient behavior. So we can use the techniques like role play, psychodrama, sociodrama. So these techniques will help the patient to have an emotional experience. Such experiences, it will bring a desired behavioral changes. The next principle is unnecessary increase in the patient anxiety should be avoided. For example, nurse is anxious. So when a nurse is leaving home, she is coming to a hospital with her personal problems, or nurse might have experienced some conflict with the colleague or the team members, and the nurse may have her own anxiety which should not be shown to the patients. It should not be directed to the patients. And the nurse should make sure that the task what she is giving to change the behavior of the patient, it should not make him to fail again and again. So if the patient fails in the tasks, he will lose the confidence, and again the patient may express the negative behavior. That means the patient anxiety level will be increased. A nurse should make sure that she is not passing any sharp comments and showing indifference between one patient and another patient. If the patient started feeling that the nurse is partial, obviously and automatically the patient's anxiety level will increase. So the nurse should be very careful when handling the patients. The next principle is objective observation of patient to understand his or her behavior. Subjective and objective. We know the meaning of subjective and objective. So subjective means what the patient expresses and what information we are getting from the patient. And objective observation means what the nurse observes from the patient. For example, you are asking the patient, "How are you?" And the patient is replying, "I'm fine." So the nurse cannot decide that the patient is fine. Why? Because we should observe the patient objectively. Objective observation should be done. So we have to check the modulation. So the patient is telling, I'm fine. And the patient is telling, I'm fine. So the difference is between these two, I'm fine. So you should observe the facial expressions. As it is said, the face is the index of the mind. So we'll be able to make out whether the patient is happy or sad or excited. So the different emotions and feelings can be observed through the face. So the nurse should make sure that to understand the exact behavior of the patient should be observed objectively. The next principle is maintain realistic nurse-patient relationship. So nurse should maintain a professional relationship, should be completely based only on the needs of the patient, like physical needs, personal, emotional needs of the patient. So the nurse should have a realistic self-concept, should have a clear plan of how the relationship is going to be. And the relationship with the patient, it should be based completely on the therapeutic basis. The nurse should have sympathy, empathy, and should understand the feelings of the patient. So it will help to understand the behavior of the patient. Let's see the next principle. Avoid physical and verbal forces as much as possible, because we are going to handle the psychiatric patients. So where already the patient got admitted with psychological trauma. The nurse must make sure that no forces apply to the patient either by words or by actions. The next principle is nursing care is centered on the patient as a person and not on the control of symptoms. So we should treat the patient first as a person. He is a human being. For example, in a ward, there are different type of patients. Each and every one will have different type of needs. So then in nursing care, what a nurse is providing, it should be completely centered on as an individual patient and not just to control the symptoms. The next principle is all explanations of the procedures and the routines are given according to the patient level of understanding. The nurse should understand priorly the comfortable language of the patient education status, the level of understanding, the attention span of the patient, the level of anxiety, and the level of ability to make decisions of the patient. Based on these all, if the procedures are explained, the patient will be able to understand easily and will get 100% of cooperation from the patient. The last principle is many procedures are modified, but basic principles remain unaltered or untouched. In our nursing field, the many new techniques has been adopted, but some nursing principles a nurse should keep in mind, that is, the safety, privacy, comfort of the patient, and the nurse should maintain the time, energy, and material, and finally, the therapeutic effectiveness, which will help the patient to recover from his or her illness. These are the 12 general psychiatric nursing principles a nurse should follow and keep in mind when she is going in front of a psychiatric patient. Thank you so much for your patience and listening. Let's see in the next video. Thank you once again.